Today, the 30th of March, is World Bipolar Day. The day aims to create awareness around the mental disorder for those diagnosed and for the general public to eliminate stigma and discrimination. Bipolar disorder is described as an illness associated with mood swings ranging from depressive lows right through to manic highs. Let's get more insights on today, the disorder, and a look at why it sometimes goes undiagnosed with Chief Medical Officer at Life Healthcare, Dr. Karisha Quarrie. Dr. Quarrie, thank you so much for the time. Appreciate it. Let's just highlight the significance then of World Bipolar Day and bipolar disorder in itself then, especially when one considers that one of the greatest painters of all time, Vincent van Gogh, a Dutch painter, was diagnosed after his death as having likely had bipolar disorder.
Yes, good morning, Arabile, and to the viewers. Bipolar mood disorder is an important mental health condition, and it's important that we all become aware of it, especially because almost 4% of South Africans are estimated to have bipolar mood disorder, and it can affect any age group, whether they are children, teenagers, or adults, and it can have significant impact on the productive years of an adult individual. So it's really important that we have an education about bipolar mood disorder.
Is this something that comes hereditary in terms of being brought down from family? Perhaps you can get it from your parents or your grandparents or down your lineage?
Yes, so the causes of bipolar mood disorder, number one, are genetic. So if you've got a relative, a first-degree relative like a mother, father, brother, sister who has bipolar mood disorder, then you are more likely to be at risk of developing bipolar mood disorder. Additionally, somebody who has structural brain changes, some studies have showed that people with bipolar mood disorder, the structure and shape of their brain is different to other people. And those are really the two main causes that we scientifically have found. Additionally, some of the risk factors that put a person at risk, besides having a relative, is having significant high workplace stress, having relationship issues, or having the death of a family member, as well as having a drug or alcohol issue that can also put one at risk of developing bipolar mood disorder.
Wait, so would you just, if we could go back here, Dr. Quarrie, you spoke about the structure of one's, I think you said brain changing?
Correct, yes.
Would that be because of physical trauma, ultimately an accident of some sort?
Well, this is from being born with a brain that structurally is different. And some studies have shown that in bipolar mood disorder, individuals, they are born with these differences in their brain structure. So it's not necessarily because of a traumatic event.
But can that develop then? Can something like bipolar actually develop because of an accident having happened in your life, or something that just develops naturally then in your life just because of a particular event?
Yes, so trauma to the brain can result in personality changes that may mimic or look like a bipolar mood disorder. But scientifically speaking, a bipolar mood disorder occurs without a structural damage to the brain.
One of the things that I know a lot of people may be asking about is you made note of workplace stress being among the key factors for getting bipolar disorder. If we're talking about elements like that, how does one actually see that happening in their lives? It's natural and normal to feel as exhausted from work and perhaps frustrated with maybe things that are happening in the office or wherever the case might be. But how then do you then get to realize and know that actually I may be becoming bipolar because of workplace stress?
Yes, so what is important is to recognize the signs and symptoms of bipolar mood disorder. That's the first, and then to recognize how do those present in the workplace. So the first, if a person is having a depressive episode in their bipolar, they will struggle to get out of bed. They will start being absent at work, not being as pleasant, not participating in activities that are pleasurable to them, and having suicidal thoughts or thoughts of harming somebody else. So that's on the depressive side. On the other side, on the excited side of the spectrum, an individual may be extremely talkative, they have flight of ideas, where ideas are just every second something is catching their attention. They may not pay attention in meetings. They may move from one topic to another as they're speaking, and be highly excited and excitable. They may take risks that they ordinarily wouldn't do with finances or with comments that they are making. And so what we see is how that pitches up in work is that we have absenteeism. So people stop coming to work because they are expressing these symptoms of bipolar mood disorder. We also have a presenteeism, where somebody is physically present in the building, but actually not functioning in the role that they were employed for. So they're doing other things, or they're not doing what they are expected to do. So that's how bipolar mood disorder will pitch up in the workplace. And it really means that managers, as well as other employers, have to understand these signs and symptoms by destigmatizing this condition within their environment, and then being brave enough to address it with the employee, because sometimes the employee doesn't have an awareness that they actually are displaying symptoms of bipolar mood disorder, and then to tackle it appropriately through an employee wellness program if they have one in place.
Yeah. That just sounds so interesting. And you said a little bit earlier that you could actually, it doesn't matter which age, right? It could impact any age as well then. Is that correct?
That's correct, yes. And it's often overlooked, especially in our teenage population, because teenagers are already going through so much change hormonally, and in their own lives. And so it's very difficult to diagnose bipolar mood disorder in a teenager. So this requires that you actually have a psychiatric evaluation and have a formal diagnosis of bipolar mood disorder. And that should be done by a trained medical professional.
Yeah, there's an actual series that I'm watching right now on TV, and I'm wondering if there's a little bit of that. I haven't finished it yet, so I'm wondering if that show highlights a little bit of what you're speaking about, actually. The second element, or another element to all of this, really is stigma. And I say stigma across racial lines. And the reason why I make note of that is because you may have that a more affluent family may be able to have psychiatric examinations, be willing to understand that there may actually be a bipolar disorder of some sort, where maybe less affluent families may not be able to do so. And that could really be stretched and marked along racial lines.
Absolutely. There is definitely still stigma that is associated with mental health disorders. And then we also have cultural differences that impact how a community or culture of individuals interprets a mental health disorder and acts to manage that mental health disorder. What's also important, and to just bring it back to the employment space, is that in a company, they also have a culture. And if that culture does not speak about breaching or breaking down the barriers of discrimination and inequality, then it can also foster a workplace that is highly stressed and stressful to the employee.
Yeah, and getting this right then, because financially some might think it's also difficult because you have to diagnose, which means you have to have the psychiatric help, as you then spoke to, and then dealing with it and later on may require medication or may require some sort of counseling and all of that too. Your finances ultimately be a barrier to finding out, to dealing with it, and to avoiding having bipolar disorder?
Correct, yes. So financially, one has to have access to resources, and often resources cost some money. And so that can be a barrier to somebody seeking assistance. Mental health disorders are a global priority from a healthcare perspective. And so whether an individual is accessing that through a public or private facility or through the employer, they have a right to access that service. And that, I think, is part of the destigmatization, Arabile, is making sure that people understand that if they have a mental health condition, it should be treated like any other medical condition, because it is a medical condition.
Yeah.
They should have access to resources, whether those are psychiatrists, psychologists, occupational health practitioners who will help with assessing the workplace environment and the stress that's associated with their work, social workers who will be able to help an individual to reduce their workplace stress and act on behalf of the employer in discussions with the employee, in discussions with the employer. So these kinds of resources should be available to every single individual, just as they would for any other health condition that is not a mental health condition. So the barrier to accessing mental health resources should not be financial. It should be freely or fairly freely available within the public health sector, as well as in our workplace environments.
Dr. Karisha Quarrie, appreciate the time, appreciate the understanding, the educational lesson as well that this certainly brings to us for a day like this. So appreciate your help with regards to this one then. World Bipolar Day, that being today, the 30th of March. More awareness being put on that. Chief Medical Officer then at Life Healthcare, Dr. Karisha Quarrie.